Hello, well, thank you for joining me for this session today, which is on breaking barriers, the hidden challenge of managing genital edema in the community. And I'm pleased to be here from the Lymphedema Training Academy and Lymph Vision. You can see on this first slide that we've got some pictures there of genital edema, which of course is what we're talking about today. And you can see the black and white image, which is a technique we use, which is called lymphofluoroscopy imaging, which we use to identify blockages in the lymphatic system. So just as a polite notice, I'm asking that you don't do any screenshots or any photographs today. All images have been provided by patients and they don't like to see them on social media, of course. This session is going to cover an overview of male and female genital edema. It's going to look at the early signs and recognition of a genital edema, the impact of a genital edema on physical systems and other health impact, and also that on mental health and confidence. So just a very quick overview and update of the lymphatic system and why that's important. Well, first of all, the lymphatic system has an immunological response. So it fights infection. And one of the new things that we know is that we have this inflammatory effect when something goes wrong with our body. Now, the next thing that's really important over recent years is that we know that the lymphatic system is responsible for taking away 100% of fluid that reaches into the tissues and the skin. And those are taken away by the initial lymphatics, and the initial lymphatics start in the dermis of the skin, and then they go into deeper collecting vessels, which have got valves within them, and they take that fluid away. So every time our heart beats, we push fluid around our arteries and then out into the tissues, and that is remained within the capillary system and will be returned, and that's pushed into the skin is always removed by the lymphatic system. So it fights infection, drains all fluid away from the skin. And the one thing that we know is really important is that movement is essential for moving lymphatic drainage. And I think the other thing to remember when we're talking about community nursing as well is that our lymphatics age and get older and get sclerosis exactly like our blood vessels do. So this image here that you've got is that of the initial lymphatic and that's connected in the tissue by anchoring filaments. Now, the next thing that I press here is just demonstrating body cells as they become inflamed. And you can see what's happening is that it prevents the stretching of those anchoring filaments, which open in order to take fluid to be reabsorbed into them and drained along the lymphatics. So what you can see on the right-hand side is that image of where the lymphatics are almost squashed, not with just inflammatory cells, but also with fat. So as we gain more weight, the lymphatics at the very beginning of the lymphatic system can't stretch, can't move, can't absorb and drain fluid into it. So that leaves us with swelling. And the only place that fluid re-enters back into the venous system is in the lymph node itself. And we've got about 500 to 700 of those. And this is where fluid gets filtered. It's also where cancer cells can be maintained if you've got a cancer pathology. So the fluid will exit the node. We think it's about 40% goes into the venous system within that node, and the rest of it continues on its journey to another node or back to the thoracic duct and circulates back to the heart. So lymph is draining into the node, and the node is influenced by pressure. So external forces, movement when we're exercising will push fluid along and drain it into the node. And the internal forces will also push fluid into the venous system that sits within the node. So that's how we manage to get fluid put back into the venous system from the lymphatics. Now, of course, we need to help reduce the lymphatic burden when we've got an edema. And the one thing that we know about more recently, over the last 10 years, for example, is that inside the endothelial cell is something called the glycochylax layer. And the glycochylax layer maintains vascular health. So we're talking about capillaries here as well as lymphatics. And the glycochylax layer is made up of proteins and sugars. And if that breaks down, then that fluid will start to leak back into the skin. And of course, the lymphatics are responsible for removing that fluid away. So we need to maintain good, healthy vascular health, the glycochylax layer, and that is through movement and shearing forces. So it makes us understand, of course, why our patients need to be active, why they need to be mobile, and why that is so fundamental in all lymphedema treatment, but also in our vascular and wound care patients as well. So what's the difference between a lymphedema and a chronic edema? Well, the one thing that we need to remember with a lymphedema is that, well, when the lymphatic system fails, we start to develop fluid within the tissue. So it is a failure of the lymphatic system, but it's usually often commencing immediately, quite often from an acute cause. For example, having your lymph nodes removed in your armpit following breast cancer treatment. It may resolve with early treatment and before inflammation starts and the tissues start to change, which is why we do need to treat our lymphodemas as early as we can. And it's usually related to either an intrinsic or extrinsic insult to the lymphatic system. So it's primary, there at birth, or secondary due to something else happening to the lymphatics. Whereas a chronic edema is quite often a very slow onset of something that's gone wrong as a external to the lymphatic system. So maybe somebody's got varicose veins, or they're overweight, obstructing the lymphatics a little bit, or the venous system isn't working as well. It's a slow onset, usually categorized after 12 weeks, and a chronic condition that usually is not going to improve amazingly, but of course it can improve with treatment. So it's as an indirect result of something to the lymphatic system. However, because the lymphatics drain all fluid away from the skin, ultimately everything is a lymphedema. So let's think about the incidence and prevalence, and the incidence and prevalence of a genital edema particularly, but you can see some of these images here where obesity plays a direct role to a compound effect of having a lymphedema or a chronic edema. And we've got people there who are overweight, tummies playing a major role to that, skin changes and venous problems as well. And this risk for lower limb edema is increased for people that have a higher body weight, have got congestive heart failure, have had an increased number of lymph nodes removed, or radiotherapy and chemotherapy with their cancer treatment. Those that have reduced normal activity, so again, we come back to exercise. Those that have got cancer or vulval cancer in their regions as well, and those that have got a pre-existing swelling. And we're talking about lower limb edema, but we should also be thinking of malignant melanoma, and that's been cited by IRA as 8% of developing a lower limb edema. Of course, it always depends on which nodes are being removed. So the inguinal node dissection is going to have a less consequence than if you go up to the iliac nodes and you take those nodes out or radiotherapy to them, because it has a knock-on effect further downstream. So what is a genital edema? A genital edema is the accumulation of interstitial fluid in the tissues of the genitalia and surrounding areas. So this is the scrotum, the penis, and all the suprapubic region, the labia, vulva, and also the mons pubis. Now, I'm also including in this internal lymphedema, which quite often we don't discuss appropriately, and also that extending to the perineum. And again, if you look at those black and white images there, that is where we've got fluorescence into the labia or into the suprapubic region, which is demonstrating that's where lymph is contained within the tissue. Who might have a genital edema in the community? Well, the types of patients that you should be considering are those following any type of surgery. And because lymphedema is to do with fluid being drained away from the tissue, any type of surgery can be responsible for that. So it could be that somebody's actually been born with a lymphatic system not functioning so well. And what has happened is that surgery, as a consequence, has led to the lymphedema. Of course, you'll be seeing palliative patients. So those may have cancer that is infiltrating through lymph nodes or through the tissue or into the lymphatics themselves, or tumor pressing on areas. You'll be seeing many patients that have got venous problems, leg ulcers, wounds, and of course, all of those are at risk of developing a genital edema. Cardiac patients and dialysis, and we've already mentioned obese patients who will have abdomens that can be obstructing as well. And don't forget that many patients that you see, or some of them, may already have a pre-existing primary lymphedema. So they've been living with that all of their life, but now they develop maybe a gynae cancer or a prostate cancer or something. So typical traits that you may see in both males and females is that they may be overweight or obese. And that's a common trigger factor. When we think about the lymphatic system, the lymphatics, if we're born with one lymphatic system, let's say it's 10 miles of lymphatics, Then as were 10 stone, that can serve us really well. But as we're 20 stone, we've still got 10 miles of lymphatics, which can't serve us as well. Of course, we do grow lymphatics, but they're not function the same as the original better ones that we have. So the other things that you may see within your patient group is that they have reduced socialization. Not going out as much. They're not talking to people as much. They don't want to go down the pub. They don't want to go and have a coffee and a cake somewhere. And so these are the kind of the red flags that you might be wanting to look at. Reduced mobility, particularly in males. If you're walking around with a heavy scrotum, then that can be very uncomfortable. It can be painful. It can be drawing and dragging as well. Reduced or fear related to libido and to sexual activity as well. So there's a fear of the penis bursting if you get an erection, or you're worried about approaching sexuality. And also other red flags, I guess, are those that have got a cancer diagnosis. So again, surgery such as prostate, rectum and kidney or bowel cancer. So going back to your females again, maybe it is also reduced libido, pain and on sex and intercourse, and we'll come on to that in a minute. And also increased leakage or continence issues for both male and female, maybe reducing socialization again. So if you're into a group of patients and you're finding that they're becoming withdrawn, maybe that's an area that could be something to alert you. What other types of things then? Other telltale signs? Well, maybe a gentleman. We know that many gentlemen will be wearing nice shirts and trousers. Maybe they're starting to wear jogging pants because their legs don't fit into general trousers, but also their scrotum doesn't. Maybe that you will see as you're maybe bandaging leg ulcers and so on, that you notice that there is an outline to an enlarged area into the crotch. Urinary problems, so maybe you'll notice that there's dribbling or discomfort and so on, and again, not going out and socializing. I think with women as well, what sometimes happens is that they hide it a bit better with a reassuring, yeah, I'm okay, but they do start to become withdrawn. Maybe they've got pain on walking again. The tissues can become excoriated and cause those types of issues also. What causes female genital edema? When we're looking at our cancer patients, I think that's probably a key one. Post-traumatic edema. We see people that are cycling, so cyclists can also get this from a localized trauma. Primary lymphedema, so you're born with it. Crohn's disease is something to look out for as well. IBS as well, irritable bowel. Also, there's an increased group of patients who will be having cosmetic surgery. You might be seeing them for suture removal or because they've got other complications. And quite often they're put into the wrong garment and it will induce a genital edema. Don't forget there's another group of post-pregnancy ladies as well that can develop genital edema, obesity we've already said, and Fabry disease. And Fabry disease is another autoimmune problem that can lead to genital edema. And those images there is that looking at that related to Crohn's disease. So you can see it's very excoriated. It's a very localized inflammation that's taking place. Now, other things to consider that we should be aware of is female genital alteration or that we would talk of. So childhood, it would start in childhood. It may get worse with time and is usually related to cultural rituals and is also, of course, illegal. The other thing to consider is gender reassignment surgery, which is becoming more common. So we might have a group of patients that are related to that with the genital edema in both male and female, and also recurrent infection or STDs is something to consider as well. And then we've got a group of patients who've got hidradenitis, which you may be aware of that with folliculitis into the axilla hairs, but it can also happen into the pubic hair. And that can lead to ongoing inflammation, and it can also lead to genital edema. So it's rarer, but it does actually happen. And when we go back and we think about this related to men again, of course, it's cancer or its treatment. It's infection, such as cellulitis or lymphangitis, granulomas, again, from Crohn's disease. Sometimes it just happens. It's what we call an idiopathic edema. And we don't really know the cause, probably a primary lymphedema, but it just starts. And then we need to think about scrotal viral infestation. So we've got patients who are from third world Africa, maybe, or India, and it's viral in a bug that gets injected into the lymphatic system and starts to grow. And another group of patients is clothing, occupation and trauma. So we've got people when you're wearing very tight clothes or very tight pants, or you're sitting all day as a bus driver or a lorry driver. And if you ever notice a man get in a car, quite often they'll do a bit of jiggling around to get comfortable. And that can be that you're causing some obstruction to the drainage and flow around the scrotum there. Circumcision. We had a primary lymphedema young man that was circumcised at birth, but that went on to a scrotal and a genital edema because he was a primary lymphedema. We've already discussed obesity, but let's think about those people that are going in for general surgery such as inguinal hernia repair, again, gender reassignment, acute infection, hydroceles, and dialysis, where you get increased intra-abdominal pressures. This publication has recently come out, Genital Edema, and this is a screening tool that's come from Rhiannon Noble-Jones and Lymphedema Network Wales, and it allows for you to identify from a clinical perspective of where you are, where the edema is situated on the penis and the scrotum, and the same with the labia for the female. So that does give you also an approach, and it asks questions such as, am I having difficulty with sitting or discomfort with walking? So you get to ask those questions. So this is some of the management compression garments. There are many different types of compression garments, and I have to say they're either brilliant or not, depending on the patient. But what is key when you're fitting a compression garment for a genital edema is to have an understanding that if the stomach sticks out and then the compression garment is trying to fit to the suprapubic, you haven't got compression onto the suprapubic region. That means that you need to pad and put an insert in or something in order to build out the suprapubic region to the level of the stomach in order to get compression to where you want it to be. Otherwise, those garments become pointless. So maintaining skin hygiene, of course, you've got to ensure that people can wash themselves correctly, reduce any risk of cellulitis, make sure that they've got dressings which are absorbing and locking away. Exercising pelvic floor, as I said, and also teaching self-drainage. So we teach patients to take their fingers just onto the top of the labia and to be able to, we call it edema flush, but flush that fluid up each side of the labia or around the scrotum in order to try and push the fluid up. Management of internal edema. So you can see on the right-hand side there, we've got a photobiomodulation, a laser. And that's got an internal probe as well, which if it's appropriate to do so with the treatment that the patients have had, they can use that in order to reduce internally, and squeezing on that as well with the pelvic floor can help. Kinesiotaping is useful, particularly for the suprapubic region. You've seen some of the photos, so I apply that as a hammock application, like a correction strip, in order to pull the tissue with the edema on and maintain a good compression. And weight management, as we said, is essential. So there's some images there of foams and paddings. You can put them out of pieces of foam as well, but you need to watch your government's issues with that. So make sure you've got the most appropriate ones for that, and make sure that you're layering them. And lots of different types of silicone foams can be available as well. So we're just going to play you a video of a personal account for a patient, and I'm very grateful that she's happy to provide that.
I have lived with leg lymphedema for over 10 years now following surgery, and I think after about 10 years I learned to cope with it the best I could, to manage it as well as I could, and sort of come to terms with it in many ways. And then about 2 to 3 years ago developed it in my pubic region. Now, I wanted to talk about how that impacts me really, because living with any type of lymphedema brings so many challenges, restrictions to what you can wear, what you can do, risk of infection, the hosiery, everything, the cost, because a lot of it's not paid for, how you feel about yourself. But for me, living with it in this area has been even more challenging. I think the main challenge is with intimacy, fear of discomfort, fear of infection, loss of libido, feeling like you are sort of detached from that part of your body, and fear of letting go. Emotionally, it's incredibly difficult to live with for all the things I've said. The the upset that you have, the guilt you have with how it impacts upon your relationship. Dealing with the sort of guilt you have constantly of not managing it as best as you think you could, because that would be a full-time job, and I already have one of those. And just that feeling that you don't feel like yourself, really. I think that's the hardest thing. So for me, I think there's a resentment that it wasn't talked about soon enough. I had no idea this could happen, really, and that's not about blame. It's just the reality. So that's the reality I'd like to change for other people. I went to my GP twice. He didn't make a link between what was happening to me and my lymphedema. The nurse that I saw, she was fantastic, but she just said to me, I just wish I'd talked to you about it sooner, about this possibility, so you might have been able to stave it off somewhat, or to help it getting so bad, which is at the point I started seeing Jane, and she's really helped. So I just urge everyone to talk about it, to raise it with their patients, and just get the messages out there to the other wider medical profession. Thank you.
When we look a little bit more closer now to men, they have the same and similar complications to what the women have, such as infection, fungal, folliculitis, lymphorrhea leaking out of papillomatosis on the end of the penis or directly from the scrotum. And it's not only lymphangiomata or lymph that can leak. In both cases, male and female, it can be chyle. So chyle is or the lymphatics that remove fluid from the digestive tract can become overwhelmed, and so you start to leak chyle, which is like a white milky fluid instead of a clear fluid. It's important to remember. We've talked about sexual dysfunction and function and continence, so all of these are prevalent as well. So what other things do we have for males? I guess garments, again, we've got manual lymphatic drainage and photobiomodulation and kinesiotaping, taking it right around the scrotum. You can apply the tape. Penile bandaging. So when you've got a swollen penis, sometimes we will teach the gentleman to use a 5 centimetre digit bandage to apply compression. They'll sometimes use convenes or sheaths, which we've got coming up onto the next slide. And sometimes we'll use a red line tubular bandage, so that it's a very small one, or the next one up, a green one, so that they can apply that. And some of these things are fantastic, or they're rubbish, depending on what the situation is with the gentleman that you're seeing. Surgery has also improved, so I'll just show you a couple of images of that, particularly for the obese group where that's worked. But thinking about what can we do? Well, strengthening ligaments, internal exercise, again, pelvic floor and those contracting the bowel as well can be assisting. Hygiene is so important again, and it has to be about reducing body fat. And also thinking about surgical intervention, what they've had. So continence issues here, retracted penis, what you can get are the funnel type applicators that you can place onto the scrotum and push into the body, and that can give direction of flow back. You can use things like convenes, again, brilliant or not, that you can place over the end of the penis, and it again gives direction of flow back. You can use a shiwi, which I've termed here as a hiwi, in order for, if they can just get something that will allow for direction of flow, because that gives back confidence. It allows for them to get down the pub again, or to go out and have a family meal or something, because they're not spraying when they go to the toilet. And that petal sheath as well, if it can be applied appropriately, can work really well with people that have got a swollen penis as well. So it will provide confidence and will allow for norms to take place again, putting them in control and allowing for improved socialization. One of the things that we often get asked about is whether it's appropriate to do catheterization for a man who's maybe got a buried or a hidden penis. And I suppose there's pros and cons to this. So it does give independence and confidence. It does assist with direction of flow, and it can potentially reduce the embarrassment if you are leaking or you're not able to aim appropriately to pass urine. So it allows for better socialization. I suppose that it can limit your independence if you're not comfortable going out. It maybe increases the risk of infection from having a catheter in, increases embarrassment if you're walking around with a leg bag. So it's not the best option, but it's certainly not the worst option. And of course, keeping people the most comfortable that they can is what's important. So just a few final comments. Early identification of genital edema is essential. Remember that there are many other causes related to genital edema: obesity, cosmetic, cardiac, heart problems. We know that ICG lymphofluoroscopy allows for us to identify early, but it is private, and of course it's not available for everyone or appropriate for everyone. Commence treatment early, ask the questions, have the confidence, make sure that you do offer any other treatments that are available, and just do the best that you can. So thank you very much, and thank you for your time, and also to the patients and the people of Lymph Vision that have allowed for us to use their images and so on. So thank you.